Alzheimer's Ghana is a non-governmental, non-religious, non-profit making organization established in July 2012 and aimed at raising awareness of all forms of dementia throughout Ghana to eliminate the ignorance and stigma attached to the disease through all the available media, and also to create a society where a person with dementia can live with dignity and honor which he or she deserves. It's the time to begin to create awareness about dementia. It has been here with us for many years. A lot of people saw it, the scholars identify it, but nothing has been done. So this is the time for us, even as we come together today, to begin to talk among ourselves, to begin to interact, connect, and to bring this message out, send it very far there, that dementia is fast catching on us. The organization has some objectives. It's raising public awareness throughout Ghana to eliminate the fear caused by Alzheimer's disease and related disorders and the stigma attached to the disease throughout the country with all the available media. Initiate and encourage formation of chapters of the association to support groups and dementia care throughout Ghana, to undertake and support research into causes, prevalence, and other aspects of dementia care, to bring to the attention of various governmental agencies the needs of people with dementia, especially the need to have dementia recognized as a disability of old age, so that they are placed on par with people suffering from other disabilities and resources are allocated in a more equitable manner for them, to encourage training of health personnel in geriatric care and dementia, to arrange and conduct training programs for caregivers, and to organize seminars, medical camps, and relief work, to provide guidance in legal matters to people with dementia and families, and to intervene on their behalf wherever or whenever necessary for feasible, spread in-depth knowledge of the disease, and to decrease the burden of care on families and encourage partnership between professionals.
Dementia can be managed, isn't it? It can be managed. It's degenerative, and you can reduce the speed at which it degenerates. When are you going to start reducing it? Are you going to start reducing it when it is already out of control, or it is now? I must start, because yesterday I couldn't locate my bag for 3 good hours. So I want to start now. If it means I start writing, putting down that yesterday I came with bag, that is the management aspect of it. And when you see the issues like that, you don't see it as remote.
Various national, states, and local governmental organizations concerned, especially health and welfare departments, non-governmental organizations, Alzheimer's Disease International, World Health Organization, and other international agencies in the pursuit of all or any of the above objectives, and further promote exchange of medical and research personnel between institutions. I'm here today because this is the time to begin to create awareness about dementia. It has been here with us for many years. A lot of people saw it, the scholars identify it, but nothing has been done. So this is the time for us, even as we come together today, to begin to talk among ourselves, to begin to interact, connect, and to bring this message out, send it very far there, that dementia is fast catching on us, and we need to do something about it. Alzheimer's Ghana has taken up a strategic advocacy role of influencing government policy and working with the government to incorporate dementia into national health agenda. As a result, the organization participated and made recommendations in a conference organized by WHO and Ministry of Health and senior policymakers with the theme Scaling Up Aging Interventions in Ghana. They are also engaging in community awareness program.
Yeah, we choose dementia because as you said, you don't know, dementia is more deadly than other diseases, but because it's a hidden endemic, which is epidemic that is killing slowly, people don't know it's more deadly than HIV/AIDS and other chronic diseases.
Alzheimer Ghana has been running a day center for people with dementia, but currently, because of lack of funds to support the organization, this has not been ongoing.
Dementia is not age-related, just a mere signs and symptoms of aging, even though it's age-related, but not a mere signs of symptoms of aging. And also, dementia is not infectious. So we want the whole country to come together and fight this silent epidemic.
Alzheimer's Ghana wants to open a memory clinic in order to aid early diagnosis, intervention, and also prevent misdiagnosis of the disease all over the country. And these are the reasons why we as an organization, Alzheimer's Ghana, are soliciting for financial assistance from individuals, private organizations, government and non-governmental organizations, and other stakeholders in this fight against dementia to help provide awareness, provide clinics, memory clinics, and other facilities to help people that are affected by dementia in the communities in the country.
It's timely. Because if you look at our records at HelpAge, there have been many occasions when we've gone to the aid of some old person who is supposed to be a witch. Remember instances, one in Kumasi, where this person wandered to somebody's home and suddenly became a witch. The police came for her own safety, brought her into shelter. There was another case when somebody was taken by the family also to some spiritual camp, and the poor woman was tied in the sun because she was confused. No, we are happy that this organization is born and alive 1 year, and we want to work closely with them, because what needs to be done is actually to find out the prevalence of this disease in Ghana. We have broad statistics about Africa, which, if you look at it, is really growing. But what we should do is to find ways and means of researching into Ghana itself, find out the prevalence, what the indicators are, so that we can deal with it. This week there's a whole lot that's going on by the G8, and the developed countries are spending a lot of money. They, of course, understand that this is a lot of money. I think in UK it's about 23 million pounds to go in the budget for this. We cannot afford to do this, and I think this is the time for us to begin to look at this disease and make sure that we find ways and means of cutting down, preventing. I think it's better than waiting until we get to the stage of developed countries where so much is paid. So, HelpAge, we are happy this is here, and we pledge to work with them, first of all, to find ways and means of studying Ghana's situation so that we can come up with real, meaning to this disease and what can be done.